Good day, everyone. Good day to our honorable panel of judges, hardworking clinical instructors, and supported classmates. We are the Group 2B from BSN 3D. My name is Nicole, and together with me is Justin May Madera, Patricia Lopez, Bea Lumapan, Fiona Lacson, and Kathleen Megila. We are here to present to you our research topic, which is mental health status of nurses during COVID-19 pandemic. COVID-19 has impacted the life and health of over a million people all over the world. As of October 13, 2020, there are 38 million cases of coronavirus around the world, with 8 million active cases and 300,000 cases in the Philippines. Mental health status is defined as a fundamental and vital component of health and a state of well-being in which an individual realizes his abilities, can cope with the normal stresses of life, can work productively and effectively, and is able to make a contribution to his or her own community. On the other hand, coronavirus is an infectious disease caused by a new strain of coronavirus. The International Council of Nurses has given leadership and reinforcement for nurses' needs in times of crisis. Nurses have been experiencing unprecedented levels of stress with different factors. This gives a threat to the mental health status of the staff nurses. Mental health status of the staff nurses is essential in order for the nurses to render quality and excellent care. Thus, this study aims to determine the mental health status of nurses during COVID-19 pandemic. This aims to answer the following questions. First, what is the profile of the staff nurses when grouped according to age, sex, area of exposure, and years in service? Second, what is the mental health status of the staff nurses as a whole when grouped according to age, sex, area of exposure, and years in service? Third, what are the top 5 factors that affects the mental health status of the staff nurses? Fourth, what are the top 5 coping strategies to promote mental health wellness of the staff nurses? Fifth, is there a significant difference in the mental health status of staff nurses when grouped according to age, sex, area of exposure, and years in service? Significance of the study. This study is significant to the following. Hospital administrators. They will be able to be guided to the what interventions should they do to improve the nurses' performance in the hospital. Second, to the nursing service. They may purposely discover how the nurses in the hospital apply the recommended approach to fulfill their roles during this pandemic. Third, the staff nurses. They will be guided on what to do with the nurses in stepping into the times of crisis and providing care.
SLS. This study will help the researcher academic institution to be aware of what is the mental health status of staff nurses. For College of Nursing, this study will help the college researcher belong to have an idea what is the mental health status of nurses. For BSN students, student nurses will benefit from the study as a healthcare provider how these nurses cope in the midst of pandemic. For future researcher, the study will help them uncover critical areas in the nursing process. The study is anchored on Cooper's and Palmer work stress model and the Roy adaptation model. These two models used to assess the psychological and psychosocial adaptation of nurses to their environment. The two models are very useful to understand the factors that influences the nurses' mental health status during this pandemic. In the illustration below, you can see the two models that being used in the study, the model of work stress and the Roy adaptation model, that further explain the profile of the nurses that includes the age, sex, area of exposure, and years in service. On the other hand, you can see the factors that affects the mental health status of nurses in a hospital. That includes workloads, fear of exposure, long duty hours, PPE shortage, fear of exposure, physical fatigue, mental fatigue, number of patients, a positive coworker, and assisting mental health. Next, you can see the coping strategies of nurses to alleviate their stress. That includes lesser workloads, seminar, standardized duty hours, sufficient PPE, adequate sleep and rest, physical exercise, leisure time, ask for social support, mental grounding, and proactive and adaptive strategies. Overall, you can identify the mental health status of staff nurses during COVID-19. Hypothesis. Below is the null hypothesis of the study. There is no significant difference on the mental health status of staff nurses when they are grouped according to age, sex, area of exposure, and years in service.
Research design, the researchers use descriptive quantitative research design. It is a quantitative method that attempts to collect quantifiable information for statistical analysis of the population sample. It is a popular market research tool that allows us to collect and describe the demographic segment's nature. For the participants of the study, the researchers chose Metro Bacolod Hospital because they have a good number of staff nurses who are willing to be a participants, and they're one of the hospitals who are affected of the pandemic. The Metro Bacolod has a total of 80 and a recommended size of 67 staff nurses. The researchers also conducted a random sampling using a ROSAP calculator with 5% margin and 95% error of level of confidence. For the research instrument, the researchers made a survey questionnaire which consists of four major blocks. For block 1, demographic profile of the staff nurses, composed of age, sex, area of exposure, and years in service. For the block 2, the factors that affects the mental health status of the staff nurses. And then for the block 3, the coping strategies of the staff nurses. Block 4, the general mental health status of the staff nurses. The first page is composed of consent of the participants, and then to ensure the validity of our questionnaire, the researchers use a good and skates validity with a score of 3.6, interpreted as very good, and Cronbach's test result is 0.7881, interpreted as a trustworthy instrument, and a standard score of 0.7.
So here is the result and discussion of our study. In here, I present the demographic profile of the respondent to start with. I have here the following. First, with the age. The majority of participants that is affected is ages 23 to 30 years old with 53.7% because most nurses today belongs to the new generation. Then the sex. The majority of participants that is affected is female with 70.1% because most nurses today are female. Then the years in service. The majority of participants that is affected is nurses working for 1 to 5 years in the service with 70.1% since most nurses today belong to the age group of 23 to 30 years old that belongs to the younger generations. Then, with the area of exposure, the majority of participants that is affected in here is in the medical ward with 23.9% because most areas in the hospital today were merged, especially in the wards. So here is our table 2. It shows nurses' mental health status was affected by the COVID-19 pandemic when grouped according to age. They have a very good mental health status. Both male and female have a very good mental health status in terms of areas of exposure. Nurses that are assigned in EQ only have a good mental health status, whereas the rest of the areas mentioned in the table have a very good mental health status. When grouped according to years in service, they have a very good mental health status. The state of mental health status of nurses as a whole is very good because nurses have the ability to anticipate issues and adaptability. So here is the factors that affect the mental health status of nurses in the hospital. I will only point out the top 5 that were listed in terms of percentage. Based on the results, 79.1% of the participated in workloads, 74.6% in the fear of exposure, followed by the 67.2% physical fatigue and 67.2% mental fatigue, and lastly, the 58.2% on the PPE shortage. The overall findings indicates that the top 5 highest factors have strongly impacted and depleted staff nurses that can be a great factors on their mental health status.
Top 10 coping strategies to promote mental health to wellness of staff nurses. The results show the top 5 highlighted most answered coping strategies to promote mental health wellness of the staff nurses are: first, adequate sleep and rest with 85.11%, second, sufficient PPE equipment with 64.2%, third, leisure time with 62.7%, fourth, lesser workloads with 59.7%, and exercise with 47.8%. For our table 6, there's no significant difference in the mental health status of staff nurses when they are grouped according to their demographic profile because the p-value of age is 0.583, sex 0.782, for the area of exposure, the p-value is 0.524, and years in service is 0.348. For our conclusion, the participants are grouped according to demographic profile, which are age, sex, area of exposure, and years in service. Majority of the staff nurses are in ages 23 to 30 years old with 1 to 5 years in service. For the area of exposure, majority of the number of staff nurses are in medical wards. As a whole, the mental health status of the staff nurses when grouped according to sex, area of exposure, years in service, and age is very good. The top 5 factors are adequate sleep and rest, sufficient PPE, leisure time, lesser workloads, and doing exercise. The top 5 coping mechanisms are: first, adequate sleep and rest, sufficient PPE, leisure time, lesser workloads, doing exercise. Lastly, the results show that there is no significant difference in the mental health status of nurses when grouped according to age, sex, area of exposure, and years in service.
In hospital administration, we would like to recommend to implement programs such as proper staffing, standardized patient ratio, proper nursing staff management, and standardized workers. In nursing service, we would like to recommend to improve existing programs that may help maintain very good mental health status of staff nurses, such as good nurse staffing. In staff nurses, we would like to recommend to find a leisure activities to have self-awareness to know when and where to ask guidance or assistance when mental health crisis happens. In USLS and College of Nursing, we would like to recommend to equip the student nurses with knowledge, skills, especially with the attitude towards self-awareness. In the future researchers, we would like to recommend to conduct a study that would accommodate larger scale of nurses. For utilization, the data will also be available to the Metro Bacolod Hospital to help them identify interventions to help them address the mental health problems of staff nurses during COVID-19 pandemic. For the University of St. LaSalle, this is to help the student nurses to be aware and to already adapt in the situation that the staff nurses currently facing during this pandemic. This is the references of our study. For the acknowledgement, the research paper was made to determine the mental health status of nurses during COVID-19 pandemic. The researchers are grateful for these people. Shaila M. Traera, RN, LPT, MN, PhD, our research advisor, Nefertiti B. Kasyangfiao, RN, MAN, PhD, RN, RES1 facilitator, Sarah Jane M. Rosales, RN, MN, RN, RES2 facilitator, IVG Adamni, RN, MN, the Dean of College of Nursing, Tony Anna Chica, RNMN PhD, our College of Nursing Academic Coordinator, Jobert P. De Los Santos, PhD, Maribeth P. Diva, RNMN, to the University of St. LaSalle Bacolod, to the Hospital Administration of Metro Bacolod Hospital for approving our letter of permission to conduct our survey, to the institution, to the staff nurses of Metro Bacolod Hospital as our participants of the study, to our family and friends, we are very grateful and we acknowledge these people with gratitude for giving us their support financially and emotionally. These people made our research paper possible up until the end of it. Thank you for listening.